Join me on part 3 of the cardiovascular system. All right, was that epic enough? Figured I'd get your attention a little bit and see if you were in tune with part 3. This is the final part of our notes for this system, so that's a positive thing. If you're not all pumped up yet, maybe that'll get you there. All right, so we've learned about the structure of the heart. We've learned about blood flow through the heart and body, and now we're going to dive into our last little bit, primarily looking at blood pressure, and then also just a few other little key things about the electrical nodes in the heart, and then lots of terms that you've probably heard related to medical procedures dealing with the cardiovascular system, namely the heart. Okay, so blood pressure. This is the measurement of force applied to the artery walls. So in other words, how efficient or how well your heart is beating. Okay, so if that left ventricle is pumping out blood in a way that's going to get all throughout your body very quickly, carrying a lot of blood to those places that we need blood to be, our organs, our tissues, there's going to be a lot of force applied to the artery walls. Okay. And this pressure is determined by several things: the force behind the blood, the pump, the amount of blood that's being pumped. So again, how good that left ventricle is at clearing out blood, then opening back up, receiving more, and then clearing out again. And then another thing that plays a role is the size and flexibility of the arteries. If those arteries are going through vasoconstriction, which we talked about last time, blood's not going to go through as quickly, or the pressure may even be greater because you're trying to fit all this blood through a tinier space. Think about if there's plaque buildup. There's starting to be blockages in the heart. Pretend those are built up. The pressure is going to be a lot higher because you're trying to force it through this tiny opening. Meanwhile, the heart's still pumping at the same rate it was. A couple of terms that we need to know of blood pressure. Atrial systole. This is when the atria contract, those two chambers of the heart contract. Ventricular dystole. We'll see a little bit more about these in a minute. It's where the ventricles relax. Now, just one big thing to note is normal. I say normal. An average good measurement of blood pressure is about 120/80. We're going to go do a lab in the next coming days. We'll be dealing with blood pressure, and we'll look at it a little more intently, understanding a little more. Now, when I say normal, it may not be for everybody. Yours may be 125/90, and you're perfectly healthy, okay? Or maybe a little lower. But this is just a really good average point, something that if you're around 120/80, man, you're great, okay? Everything should, well, I say you're great. That's normal blood pressure. Your blood pressure isn't being affected by any type of blockage or heart disorder. Okay, so there's two terms worth knowing about with blood pressure. Is hypertension is one. This is a disorder where you have chronically, that means continuous, over a long period of time, high blood pressure. Okay, so chronic high blood pressure. Typically, it's marked as exceeding about 140/90. Again, we'll do the lab. If you've never taken your blood pressure, at a doctor, or even sitting down at Walmart or someplace like that and sticking your arm in the cuff. I used to do that as a little kid, not knowing what those numbers meant, no clue. I just wanted it to be green on the screen, But if you've never done that, we'll definitely see that a little more. And you get these two numbers, and we're going to learn more about them in a minute. But if it exceeds, especially around 140/90, it stays that way for a long period of time. It's been that way, even if you're relaxed. That's called hypertension. It's also known as the silent killer, because it a lot of times don't show many symptoms over years until finally it just gets critical. Some chronic if high blood pressure or hypertension is left untreated, you see here it can lead to atherosclerosis, blood vessel damage. It can also lead to a heart attack or just heart failure, and then also a stroke or kidney failure. So all life-threatening conditions. Hypotension, the other side of the coin, if you will, is low blood pressure. Now, these symptoms aren't nearly as severe as, say, like a stroke, but lightheadedness, dizziness, fainting. You see at the bottom here, common causes can include a reduced volume of blood, say from an accident or losing blood, heart disease, and also more commonly medications. People will take lots of different types of medications, and one of the side effects could be hypotension. You start getting lightheaded, you get dizzy, you even may pass out. This is what's happening inside your body is there's not enough blood flowing to the organs of the body. It's inadequate. This is defined primarily by signs and symptoms of low blood flow, not a specific blood pressure number. So a minute ago I said if you had over 140/90 chronically, you probably got hypertension. It's not like you would chronically have 100/60. Okay, it would probably be a spell of that. So hypotension is not nearly as common, not nearly as deadly as hypertension, but we may see it because of side effects of different things, say from an injury or medication. All right, so when we measure blood pressure, and we'll go over this more in depth, we've got these two numbers. Systolic pressure is the top number. This is the pressure inside the artery when the heart contraction pumps blood through the body. In other words, this is when the pressure is at its greatest. Okay, when that artery is getting all the blood flow that's coming through there, the systolic number. So that's why it's higher, because that pressure is higher. Diastolic number, or the diastolic pressure, is that bottom number. And this is like when the artery is resting. The heart is filling up with blood. So it's a very short amount of time in between these two pressure points, or places that pressure is being measured. But the diastolic is when the artery is almost like it rests. It's just kind of getting the blood flowing through. It's not got the pressure behind it. What's really troubling is when that bottom number gets high, because that means even when your heart is not pumping at its greatest point, you're still got a high blood pressure. The arteries are still being put under immense pressure. That is not a good thing. That's normally a sign of a lot of plaque buildup or weakening of the artery. Something is not right with that one. And of course, these do fluctuate. If you're doing a lot of cardiovascular exercise at a moment, your heart rate's going to be higher. Your blood pressure is going to be higher because your body is putting strain on your heart, saying, we need more oxygen, we need more blood, and your heart's responding to that. So it's going to be pumping out a lot quicker at a faster rate, yes, but also more pressure behind it because it's trying to push it out quickly to those muscles that needs the oxygen. There's certain devices that we'll learn more about next week. You might see these at a doctor's office. Let's see if I can say it right. Sphygmometer. See, I hope that ain't right either. It's one of those words that gets me. Look at all them dang things, letters. But there's a manual one. We're going to use actually an automatic one, like the cuff you may see at a Walmart or a Sam's Club, that you can sit down. We'll look more at this later on, but these are used to kind of collapse the arteries and then loosen them up, and it gets a very accurate measure of your blood pressure. All right, so don't stress out more about blood pressure. If you want to know more, we're going to have plenty of time in lab to talk about it, to learn a few more things, especially if you're looking to go into some kind of medical profession, EMT, paramedic, nurse, doctor, anything like that. You'll probably want to know more about it, okay? So looking at some commonly used medical devices and techniques that you've probably heard of, just want to kind of give you a look at it. Maybe you've heard of a relative or something going through this, or a friend. A PICC line is a peripherally inserted central catheter, typically put in the arm, and then what they do is they actually run a line through these veins. Typically starts in the arm or underneath the arm here, depending on where the comfort place, level of the person. Runs up through there, and they run this line just feeding it through, just like if you were, if you ever done plumbing with a snake or something, not a real life snake, that's what they call the plumbing tool. You just keep running it through the line to possibly clear up a clog, moving it. Then here they will move it into the heart, sometimes into these coronary arteries, trying to push away or open up those arteries. The PICC line can be used to insert a stent as well. We mentioned the stent, that mesh-like thing. It can be used to drop that off and then expand it. And then the PICC line is pulled out, leaving the stent, hopefully, to keep that artery open. You might also hear of a port. A port is simply a way so you don't have to stick somebody over and over to inject blood into their veins or arteries. So that port can be put in, left in, and then you can put injections into the port through a series of tubes. Another type of catheter besides a PICC line, this is called a Hickman catheter. Instead of using the arm, it's run through the chest, upper chest area. Still the same principle that the catheter is run and put in there, and then it feeds it through blood vessels to the heart. All right, looking at the electrical system of the heart, something very, very interesting. We're not going to get deep into it, but if it interests you, man, there's a lot of good resources out there. The conduction system. Sinoatrial node, the SA node for short, is what everybody kind of looks at as. It's a group of cells that generates electrical current. Of course, this would be tied into our nervous system. This provides us electrical current, and these sparks, it's like an engine, how a spark plug can provide that spark that makes the engine run. These SA nodes sparks, causing that right atrium to contract or pull together, pushing blood on through where it needs to go. The SA node has a nickname called a pacemaker, and you might have heard of that before, an artificial one that we're going to look at here in a minute. SA node sets the pulse rhythm. So what kind of boom, 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 boom? The AV node, or atrioventricular node, is located between the right atrium and the right ventricle. If you're looking for those, where they would be, they're signified in this diagram by these yellow kind of groups of cells, these nerve-looking endings. Okay, the AV, it's a secondary pacemaker. That's why we have the boom, 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 boom. Not only is those valves opening and closing in a certain rhythm, but the reason we have that pattern and the force and the amount that comes from is these nodes. So SA and the AV nodes. I mentioned artificial pacemaker. This is what it is. If you hear about Papa getting a pacemaker put in, it is a battery-operated electronic device inserted underneath the skin. But what happens is these leads, these wires come from the pacemaker, and they actually go in and somewhat replace the SA and the AV nodes that maybe have gotten burnt out, maybe not as useful as they used to. But this pacemaker makes the chambers open and close, contract and expand, or contract and relax, and keeps the heartbeat regular and at an appropriate rate. Pacemakers are a really cool development. They're still, they're so much better now even than 20 years ago they were. Now they have batteries that last a lot longer, so you don't have to have your pacemaker replaced quite as frequently as you used to. Arrhythmias is any problem that affects the electrical system of the heart. There's several different types, so it changes up the heart rate. A bradycardia is when you have a heart rate of less than 60 beats per minute, now chronically. Now, if you were to take your pulse at your age and in hopefully good health, you're probably going to have a resting heart rate of less than 60 beats per minute. It may be even as low as like 40. That doesn't mean you have bradycardia. Bradycardia is when no matter what you're doing, your heart rate still stays very low. No matter how old you're getting, it still stays very low. And you can see the symptoms there. It's basically fatigue and dizziness, lightheadedness. Tachycardia is a rapid heartbeat. Once again, not even if you're running or doing anything crazy like that, you're just resting, your heart rate is very, very rapid. There's not really a number we put on that. It's just more rapid than an average person for your age and health. Atrial fibrillation is a type of arrhythmia where it's an irregular heartbeat, okay? And it's caused by not like a physical problem inside the heart, but it's erratic electrical signals. So your SA and your AV nodes are kind of out of whack. How do you fix that? Pacemaker is most likely going to be the way. Get through these real quick. Heart disease, you've heard these terms before. This is any condition that stops normal heart functioning, okay? One specific one we hear about is congestive heart failure, and this is when that left ventricle, down here, remember that's the super pump, the big pump, the one that's going to push blood out of your body, it's pumping inadequate blood to the body's other organs. Sadly, a lot of times you hear this term congestive heart failure when somebody is on death's door or after they die. They died from congestive heart failure. This is a very, very serious condition because it's not pumping blood out to your body. Now, looking at some birth defects, congenital heart defects is what we call that. This happens to babies at birth. Both of these, don't worry about them too much, learning the things. Just know that a lot of times babies are born with a heart in a hole inside that septum. Remember, the septum is right here. So they would have a hole and blood would be able to leak back and forth. Of course, that would hurt the flow of blood through the body.